We know that tumors in individual patients are composed of many different clones of cells that have different spectrum of mutations. It's not just one uniform population of cells, but rather a composite of many different populations. And the diversity of populations of tumor cells, similar to the diversity of any population of living organisms, has a greater chance of survival if it has greater genetic diversity. So presumably tumors that have more combinations of mutations in their different clones of cells have a greater chance of some of those populations surviving after some kind of treatment. What we're now observing is that there's also evidence of a great diversity of clonal populations from the epigenetic standpoint as well. So by measuring DNA methylation profiles in patients with DLBCL, we have found that there is a great deal of evidence of diversification among the cells in any given patient. DLBCLs are especially diverse from the epigenetic standpoint. And the degree of diversity, you can actually measure the degree of diversity from these profiles using new analysis tools. And what this has shown us is that those patients that have the highest degree of diversity from the epigenetic standpoint are those that do the poorest. The ones that have the least diversity have better outcomes. This has now been reproduced in 2 published studies that were led by Rita Shaknovich at Weill Cornell. And there's a third one that is currently under review showing the same thing. So now there are 3 independent studies that show for the first time that diversity in the epigenetic compartment is an indicator of how fit tumors are to survive treatment with some kind of toxic therapy that would cull back those cells.